Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. I am here with Linda Dula. She is a regenerative medicine specialist at Invigorate Asheville, and that's located right here in Asheville, North Carolina. She is board certified in family medicine and certified by the American Association of Orthopedic Medicine in Prolotherapy. Dr. Dula grew up in the Asheville area, and she's seen it grow into the thriving, health-conscious, progressive community it is today. She graduated with a Bachelor of Science in Chemistry from the University of North Carolina in Asheville, where she studied as a North Carolina research scholar. She attended medical school at Virginia College of Osteopathic Medicine at Virginia Tech. Dr. Dula also received traditional medical training and additional hours in structural medicine. Most recently, Dr. Dula practiced family medicine with Mission Health System. She has done extensive additional training in nutrition, natural treatments. Her work with IV invigoration is her latest endeavor into the promotion of balance and whole body wellness. In Dr. Dula's free time, she enjoys hiking the beautiful Blue Ridge Mountains, floating the French Broad, traveling and spending time with her large, extended family. Welcome, Dr. Dula. Welcome. Thank you
Thank you for coming.
For agreeing to be my guest today. I love meeting with healthcare providers in the area and educating my patients and the community on what services are available to them. There's so many things that healthcare providers are able to do to help a patient in a different way that patients are not aware of. So you specialize in regenerative medicine.
Yes.
Can we talk a little bit about that? What is regenerative medicine?
Yeah, that's very broad. So there's a lot of things under regenerative medicine. So we started out as an IV clinic, and we were doing just hydration. So for lots of reasons, for after travel, after exercise. We did a lot during COVID of people trying to keep from getting sick, and then afterward for post-COVID and to recover from that. For performance, we have a lot of athletes that do it before events or getting ready for events or after events. So just for lots of reasons. And then we branched out into a lot of other treatments.
Yes. So the IV, I guess we'll start there since I know you do a whole lot of that. I know I have your menu right here. You do it for if you're sick to recover, just like you said, for athletes if they need. What would you say is one of your most popular treatments that you can?
Right now, probably our higher dose vitamin C, we call it vitamin C plus, and our Glow Plus, which we called it that because it was really good for skin, but it helps a lot of other things, and it has a lot of phosphatidylcholine in it. So we add that onto a lot of other drips, but it's a really good one in itself.
So a typical treatment for someone that's watching this right now that's thinking, IV, how does, I know what an IV is about. I've received one in a hospital. What does a typical treatment look like in here?
So we do a lot of just basic IVs. So if somebody comes in and if they want to try this first, it would be good just to have one of our basic ones. And we have all kinds from just fluids on up to lots of vitamins and minerals. So you can get just a basic one. The Simply Invigorate has just a liter of fluid with one medicine like headache medicine or nausea medicine or antacid or something like that, or oxygen. You can sit and breathe oxygen for a few minutes while you're doing it, and you can add more vitamins and minerals. And a little ways up, several of them come with a second liter, so you can get 1 or 2 liters. And of course, we evaluate to make sure you're safe to do that. We check your vital signs and check your history and why you're here. And we adjust that to see if you can tolerate it. So several of them include 1 or an optional second liter. And they go on up to a lot more vitamins and minerals.
So a treatment lasts how long?
One regular IV runs in about 30 to 40 minutes, and then if you get another liter, it's another 30 to 40 minutes.
Okay. I know that I'll take pictures and post it with this, but I know that you have a very comfortable office here, very comfortable setting, couches, loungers, recliners.
Yeah, we want it to be kind of a spa experience. We want it to be very relaxing. It's dim, we dim the lights, and try to make it as comfortable, quiet as we can while you're here.
It does not feel like a hospital at all.
No. And if you do need fluids for something that you've been sick or something, it's a lot easier to come in here than the hospital. You can get in and out quicker and much nicer setting.
Yes, and for someone like myself, I've always been a little skittish about giving blood, drawing blood needles, IV, but I feel very comfortable in here and would.
Yeah, and we get some people that are a little bit needle phobic, but they do really well. And our nurses are excellent. We have all nurses from the hospital who have been on the IV team and the emergency room, and they're very good at IVs and very gentle.
So is it a one and done with the IV? Do you typically just get one treatment, or do you have a series of them once a week? What is the typical, or does it depend on the person?
It depends, and it can be one and done. And when we started, we worked with a company in Charlotte, and they expected and we expected it would be more of a hangover clinic, and that would be one and done. But it turned out we don't do that. We do more long-term, people who care about their health and regenerative things. So we really are doing more wellness, not just acute issues, but it can be that. But a lot of people come in just to feel better. So if they're feeling a little dehydrated, some people come in once a month, twice a month. It's different for everybody. And if somebody has had something, say they are getting over something, or they've come back from a long plane ride, they may come in several days, once or twice a week for a while. So everybody's different with that.
It varies, yeah. How did you get into regenerative medicine? Because you're a doctor of osteopathic medicine, correct?
I'm a DO, which is Doctor of Osteopathic Medicine, and I'm board certified in family medicine, but I've always had an interest in regenerative medicine, and I did osteopathic treatments in my primary care practice, which was with Mission Hospital, and I left there 5 years ago to do this, but I've always had that interest. And as I've been here, I've found other treatments to add on that would be complementary to what I'm doing. And so the IV is kind of the basis of everything, because we often do that in addition to other treatments, but we've added on all these others now.
Yes, and let's talk about that. So I guess prolotherapy is probably one of the hottest treatments that you have.
Yeah, I have been working on prolotherapy even before I opened this. So prolotherapy is injections for pain. It's short for proliferative therapy. And it induces your body to bring in your own healing factors and heal your tissue itself. So we're using your body's own natural processes to heal. And the basic treatment that I do, prolotherapy, is just injecting dextrose, which is sugar. And so that's kind of counterintuitive. You would think that's not going to help anything. But sugar is inflammatory. And I always explain this to my patients. Inflammation is the basis of healing. And for instance, if you cut your finger, it swells, it hurts, it bleeds, it turns red, and those are all signs of inflammation. And that tells your body to come in and bring your healing factors in. And in your cut finger, it'll clot your blood off and make a scab and pull the skin together. Well, that's how you heal skin, but you have something like that to heal everything in your body. So we're using that process to heal ligaments and tendons and joints. And so I'm injecting usually into the ligament or the joint, and it just induces your body to bring in healing factors and heal that tissue. So it's not just masking pain, it's not just taking inflammation down, it is actually creating inflammation and regenerating that tissue. So it is actually repairing it, not just taking care of it for a short time.
Correct. You're speaking my language. As a chiropractor, that is what we want to do. We want to line up our treatments, our force that we put into the body with the healing ability of the body.
Right.
We don't want to get in its way. We want to assist it. We want to stimulate it. And I love that. I love what you're doing. In some cases, for example, if a person has a knee injury and they're just not able to reach that level of healing, no matter how many times we adjust it, or if they're getting physical therapy and that tissue just cannot heal fast enough, this would be a perfect example of how integrating, having the patient see you and have that assessed, and perhaps that tissue needs some assistance in the healing process.
Right. I always tell body workers, like chiropractors, anybody that does body work, but if you have a patient who's just not getting better, it may be because their ligaments are lax, and ligaments attach muscle to bone. So if the ligament gets lax, which it can for injury, overuse, just lots of things as you get older, the muscles, you have to have a level of tension in there. So the muscle will become tense to compensate for the ligament, and you get muscle pain. But it's not coming from the muscle, it's coming from the ligament. So if we can regenerate those ligaments, then the muscle will relax, the ligament will be strong, and the pain will improve. And it will make what you do work better. So I tell my body workers, if you've got somebody that's just not getting better with what you're doing and you think it should, then if we can tighten up those ligaments, it will let what you're doing work.
I love that.
Yeah, so they're complementary. I mean, it's helping both sides. So yeah.
Can I keep you in my office with me? So here's the thing about prolotherapy too that I learned from you last time I spoke with you, is that prolotherapy it regenerates the tissue. So it's not something that you necessarily need to do over and over again, once a month, once a year. It's you do it and it regenerates that tissue and can oftentimes resolve the problem.
Right, and I tell my patients, once we've regenerated it, it's done. So it's not, we don't have to keep doing it over and over if we can get to that point. And some people are good. I have had a handful of people good after one treatment, me included, but I don't expect that. But once it is regenerated, it's not going to all of a sudden fall apart. So unless you have an injury or an overuse injury of some way that you move that is not optimal, but we don't know what that is. So if you're 50 years old, then in another 50 years you may have problems, because it took that long to get here. It may be sooner, but it's not going to just fall apart. So, because you've regenerated that tissue.
So the most common areas that you inject, what would you say they are?
I do almost all knees and low back, but I do all areas. So I do the whole back and in sections. The back is quite a few, and I will tell people this is more than one injection. And that was my training. I know there's some people that do a few at a time, but I usually treat the whole area, and so it's multiple injections. But so we can't do too many of them at a time because it would just be too much of the medicine that we're using. But what was I going to say?
The number of needles that you give
is
quite a bit.
It is a lot. Yeah. But we do little shallow numbing injections at the skin, and those sting because you're not numb yet, but they're very shallow. And then we go through that to the deeper tissue. So the deeper ones don't hurt as much as the shallow ones, really? Because everything in my syringe is numbing and I'm injecting as I go. So,
and that's something unique that you do. Some providers don't put that numbing agent in there.
Yeah. Some of them do, or some of them don't do it as they go. Okay. So they do the shallow one and the deep one, but Yeah, so don't want to talk about other ones.
Yeah.
Yeah,
So you would say knee and lower back are the most common areas that you find you work on, but you are able to do shoulders, you can do hips, virtually
yeah,
any
knees and
area.
hands hands and feet and elbows and just everywhere. So yeah, we
Yes.
do all over the body. And trigger points. So trigger points aren't going to the ligaments, they're just going into the muscle. So we can do those other places too. And often I will do some trigger points along with the prolotherapy.
And what kind of response do you see with that trigger point? Is it immediate? The muscle opens up? Does it sometimes take
It is, but because it's lidocaine, so it's and that is numbing. So once you numb up an area, of course, it immediately stops hurting. And the goal with trigger point is to interrupt a pain pathway. So you've got nerve fibers that are triggering to the spinal cord into the brain, and we're just interrupting that pathway, and hopefully that it doesn't pick back up when the numbing wears off.
Yeah.
So that's what we're going for. But initially, you do have immediate relief. And with prolotherapy, it's nice because I use some numbing medicine, but dextrose, which is the prolotherapy medicine, the proliferant, is also numbing. So when you have pure prolotherapy, it is initially numbing, and which is nice. When you walk out of here, it doesn't hurt, but when it also tells me I got in the right area. So if I have numbed up the area that you had pain, then I know I've gotten in the right area.
Okay.
And I know that will work. It will take about 3 to 4 weeks. You'll get about as much benefit from each treatment in 3 to 4 weeks, and then we see if we need to do it again. And sometimes we do. In fact, usually I was taught that people would normally need 4 to 6 treatments. I don't often do that many. I usually do more like 2 or 3. And like I said, I've had a handful of people that were good after 1. So everybody's different with that.
And you space the treatments out once every 3 weeks or so?
4 to 6 weeks.
Okay.
Yeah, they'll get benefit over 3 to 4, and then I like to wait for or a little longer.
See how they respond. Yeah. And what about activity? Can a person resume their normal activity during this time, or do they need to
Yes,
stay away?
usually they can resume activity, and I do want them moving because blood flow brings in your healing factors. But I have to caution them not to overdo because they're numb and they're feeling so good, they'll think, oh, I can go out and run a marathon. So I don't want them to overdo and ruin what we've done, but I just tell them gentle exercise and gradually add back heavier activity, especially if they do heavy lifting or heavy exercise.
So prolotherapy is great for regenerating the tissue in an acute injury, chronic injury. So if we're talking we've had a sprain strain, whether it was old or we have chronic repetitive use syndrome. Can it also be helpful with osteoarthritis?
Yes, osteoarthritis is one of the main things that I treat. It can do acute injuries, but I usually like to wait 3 or 4 weeks so that they have as much collagen growth on their own as they're going to have. I don't like to treat a real acute injury. So I normally wait on that, and typically I will do osteoarthritis or injuries like tears or things that have been longer term. But the real acute things I wait just a little bit.
So prolotherapy is one adjunct therapy that you do in addition to the IV fluids. What would you say is your next most popular? Is it the stem?
No, we're doing a little of that, and I'll talk about that in a minute. But we're probably in the IV line. The next would be NAD.
NAD.
Yeah, and NAD is short for nicotinamide adenine dinucleotide, which is a long word, but it's I think of it as a high dose niacin, which is a B vitamin, but it has been found to regenerate neural pathways. So our initial indication for it was for addiction patients, but we mostly don't treat addiction patients. But for addiction, they found that we can do it 10 days in a row, and they basically are not addicted anymore, and they don't go through real severe withdrawal. So it's really dramatic.
Are we talking drugs, alcohol, smoking, any kind of addiction?
Any kind of addiction.
Wow.
And it takes cravings away, which is really amazing. But they found that after that 10 days, they've done MRI before and after, and that the midbrain has actually remodeled, and it looks like they've been in rehab for a year. So it's measurable on MRI, but it's doing that for everybody. So our main treatment that we do now is just recovery for people stressed, and there's people are stressed for lots of reasons right now. But it's very good for anti-aging because it's a strong antioxidant, so it rebuilds mitochondria. It helps kill bacteria, virus, fungus like an antioxidant. It's really good for skin. It rebuilds your skin basement membrane. So it's good as an antioxidant, but it's also reworking neural pathways. So it's a little bit of a difficult treatment because it causes some chest tightness, not pain, but tightness. So we do it very slowly and try to minimize that as much as possible. And people feel really well after, not during, but after. You just feel well. You just feel like life's okay, the world's not falling apart. It's just really good for stress, and we've seen really good results.
And is this a reoccurring treatment, or is this kind of a one remodel the neural pathways once and maybe you revisit if you've had a really stressful event years later?
You can do it. You can do one and you can do one as you need it. If you
one
feel
session
like,
of 10 visits, correct?
No, just one treatment.
Okay.
No, the only people that do a series of 10 are the addiction patients.
Okay, gotcha.
Other people, if they really have something going on, a major stress, they'll do it twice a week for a month and then start doing it less often. But you can do it just once and just once as needed too. Okay. Really, the addiction ones are the only ones we do a big series like that. So, it's a much shorter treatment.
Yeah. Mm-hmm. Wonderful. You're talking me into it. So this is administered through IV as well. Mm-hmm. I know that you also offer ketamine, mm-hmm. which that is a treatment for depression and anxiety, correct?
Yes, and that's still off-label, but the FDA did approve it as a nasal spray, but they haven't officially approved it as an IV yet, but it's been used for years by psychiatrists, and they found incidentally, it was used as far back as Vietnam War. They used it in the field because it's an anesthetic, so they still use it in surgeries quite a bit, and they were mainly using it for children and elderly because it's so safe, doesn't depress the breathing. But they used it during Vietnam they could get men out of pain and get them out of the field to where they could treat them safely, and they could either just get them out of pain where they could walk out, or they could completely sedate them. But they found incidentally they weren't depressed, so they started using it for that, and it has a really good track record so far. So I've been doing it for about 3 years and have had really good results. Everybody's different with that too, mm-hmm. But I treated patients as a family practitioner for years, and nobody ever told me they were not depressed. And with ketamine, several of my patients have said, I just don't feel depressed anymore, which is amazing because there's really nothing else that does that. So it has been a really dramatic treatment, and it is a series of 6 over 3 weeks. And then boosters as needed. And everybody's different with that. Sometimes people can do it monthly, but more people do it quarterly or less. And I've had one person that did it in 5 years and didn't do it again. And wow. So we did another series and hasn't been back since. So everybody's different with that.
How exciting for somebody that only sees darkness and thinks there's no way out and thinks they have to live on medication, which may or may not really help. And then, they get this and it can totally change. And this is the same idea as the NAD. I think I was reading in that it changes some of the pathways neurologically.
The neural pathways, and they don't really understand exactly how it works yet. But that's their understanding, is that it's working on those neural pathways. And yeah, so it has really been amazing. And we do require a psychiatrist or primary care physician referral because we are just providing the infusion. So we need to know that they are being treated for their other conditions outside of our office. And a lot of them do stay on their medicine, so it's not necessarily getting them off, but that can be a goal that they work on with their primary doctor.
For sure, because even some people that are still on medication never feel well, never have a day without depression, and they're still on medication. So yeah, if you have to still take the medicine, but you're happy and that darkness is lifted.
Yeah, that's
totally
amazing,
worth it. Yeah,
that's devastating. Yeah,
for sure. So we've talked about the IV, the Prolotherapy, we've talked about NAD, we've talked about ketamine. I know there's more.
Yes, that was all about prolotherapy. Excuse me. So a newer treatment that we have is biologic serum, autobiologic serum. So it is from the patient, and we draw blood, and I send it to my lab with a doctor I work with in Florida, and he can spin down and recover stem cells. So it is a stem cell treatment that we're getting from the bloodstream. He's in the process of patenting it, and we do a lot of different treatments with it, but our main one is that we can nebulize it, and he's patenting that too. Nebulize it, and it will treat excuse me, a lot of different things, so almost anything, but he's done over 70 studies with it in his clinics, and is having really amazing results.
What would you say is the most common thing you treat with it?
Well, we're treating all different things with it. So definitely lung stuff because you're breathing it in. So, I have a pulmonary fibrosis patient, COPD, asthma. On his website, relogix.com, his case that he has on there is an asthma patient, a young girl who was 4 years old when she got really severe asthma, and she was premature, so lungs are of course the last thing to develop because you don't need them until you're born, and so her lungs really never developed properly, but she got really severe asthma, was on steroids a lot, and she was on nebulizers a lot. She started her periods at age 9 because of it, and so her parents found Dr. Taylor and started her on this treatment. And she, within 2 weeks, came off all her medicine, and she was on it for about 6 months, and it looks like her lungs just were able to finish developing.
Wow.
And so she is living a normal life now. So, the lungs are the most dramatic because you're breathing it in, so that's the first place they're going. But also, it exchanges with your oxygen, like when you breathe every time, and it goes into the bloodstream and goes wherever you need it. So your body will send it wherever you need it. So we may be treating something in the lungs, we may be treating a lot of different things, but you may notice other things improve. You may all of a sudden, my nails are growing, my hair, just different things. Joint pain might improve, all kinds of things, because your body knows where it needs to go. Stem cells are what is called undifferentiated cells, so they can differentiate into anything. And it's what you were made from in the womb. So it can turn into bone, blood, skin, organs. It can turn into whatever you need. So your body knows what it needs, and it will send it wherever it goes. Yeah, your body is the ultimate wisdom. So it'll go where it needs to go. And we hope, of course, we're trying to address a particular issue, but it can go wherever you need.
Yeah, I love that. It's treating the whole body, which ultimately.
So, and we've seen good results. He's seen good results. But can we stop it for a second? The ones I hate.
We're on Facebook Live, so not yet.
What?
Yeah.
Okay.
So here we go. So
okay.
Don't go there. I know you're doing some fun stuff with facials as well, regenerating tissue in the face.
So,
Can't you see her glow right now? She had a
I
treatment
had one
last
yesterday,
night.
yes.
Her
And I'm
skin
afraid I
is,
look sunburned. But
you're glowing. It's beautiful. So let's talk about some fun
so,
stuff that you do.
Yeah, so stem cells, of course, can regenerate anything. So I did my facial with this, and I've got some pictures that I'm able to use to show people how it works. But it's basically microneedling. So you're just doing little needling around the face and then putting the stem cells into that. So it regenerates your skin tissue. And again, it is regenerated. It's not a facial where you're pulling anything, so it's going to look completely natural.
It really does.
It's not going to pull anything tight. It's not going to diminish. It's just going to basically fill in what you had when you were younger. So it's really amazing. And everybody's different with that too, so it depends on your underlying, how your skin is, your
health.
Your health,
Diet, all of that.
your immune system, all of that. Yeah, diet is huge. So I always talk about that with all my patients. But yeah, so this is the facials are really dramatic.
And how long does the treatment last? Is that dependent on the person as well?
Well, that again, you've regenerated tissue, so it's going to take years and years for it to undo it.
Okay.
It's going, you're however you're old you are now, it's going to take that long. But it's, whether you'll get that result that you want, it may take a little bit of time. He recommends it monthly, so we do it monthly. And I have some pictures of someone, it's quite dramatic. She had 4 treatments, so it could be that, could be longer. Mm-hmm. But again, everybody's different with that. But it's really amazing. There's another one people may be familiar with that is done with PRP, and the trade name is vampire facial, and I don't do that. But that is using the platelets, but this is stem cells, which are stronger than platelets. Platelets are also very healing. And I do platelets in with the PRP, which is platelets, in with my Prolotherapy, and it is faster and stronger. But the basic Prolotherapy is much less expensive and an easier treatment because like I said, it's numbing. Platelets are more irritating to the tissues.
So the facials that you do, would you say that works with changing the consistency of your skin, making it tighter, reducing fine lines and wrinkles?
Yes, it would do all of that. Mm-hmm.
Okay.
All of that.
So instead of maybe Botox or plastic surgery, we would come see you.
Yes.
Okay.
And Botox, and people probably know this, but Botox just deadens the skin, so you don't wrinkle. So you don't have wrinkles because your skin's not able to wrinkle. But so that wears off, and when it does, that's pretty dramatic too. But this won't wear off. Once wrinkling and filling in areas is done, it's done, and it won't undo. So, and you're not going to have a real dramatic change during, because I had mine yesterday,
and she
I'm
looks
able
great
to do that this today. So it's not real.
Not going to put you down.
It's not going to
go
put you
high
down.
for
It's
weeks.
not terribly painful. It's
Yeah. Okay, I'm setting my appointment up on the way out. But so if a patient wanted to come see you, because you offer a variety of services and treatments, and you help people with so many things, can they set an appointment up with you and just have a consultation, if you will, or a meeting, and then you decide what typically needs to happen based on what their needs are?
Yes. I make consults, and then we come up with a plan. Sometimes if I know they're coming in for Prolotherapy or something, I can do a consult, but if we go ahead and decide to treat, I can do it right then. But some of my longer treatments, we set out a plan ahead of time, and we set that up at the consult.
Okay. So for anybody that's listening to this and they say, I need to see Dr. Dula, what she's doing is great, how would they go about making an appointment? Do they call, go to your website?
Either one. They can call, they can go to the website, and they can schedule directly from the website.
Great.
So
Okay, and we'll put all those links here, so in case anybody wants to do that, they can do so. And you are located right down the street from me, Hendersonville Road.
Yeah, not far at all, in the Fresh Market Shopping Center on Hendersonville Road, right next to the Blue Ridge Parkway.
Across from Carolina Day.
Across from Carolina Day, and about 2 miles south of I-40.
Excellent, yes. Mm-hmm. And so what you do is very complementary to what I do, to the chiropractic and physical therapy. So any of my patients listening to this, if you want to know more about Dr. Dula, I'd be happy to make that referral and communicate with her about your particular case so that we may help you more together.
Yes.
Is there anything else that you want our listeners to know about you, your practice, regenerative medicine, anything we didn't talk about that you think is important for everybody to know?
Well, I just want people to know that we have a really welcoming clinic, and we would love to treat anybody who's interested in hearing about any of these. You can always come in just for a basic IV and see the clinic and talk to us, and would love to have them anytime. Regenerative medicine is really my main interest, and just want to try to help people and spread this as much as we can.
Well, I am so glad you're here in this area. I'm so glad that we've met and that you're a resource for our patients, for our community, for people that want true health, whole body health. So thank you for doing what you do. Thank you for being my guest today. And if anyone has any questions about Invigorate Asheville, you can reach Dr. Dula. If anyone has questions about chiropractic, physical therapy, feel free to reach out to me at Back in Balance. Thank you for watching and joining us today.
Thank you.